We are live, I believe. So good Thursday. My God, Thursday morning. I said Tuesday morning. Happy Thursday morning. Fresh cup. Second of the day. Good morning. Wanted to do another video. We're going to continue doing these lives. It seems like people are watching them, enjoying them. Feel free to comment, engage, give me your thoughts. Maybe I'm wrong. Maybe I'm right. Maybe you agree. Maybe you disagree. But tell me your thoughts down in the comments on the topics that we're talking about, and you can certainly go back and look at other videos that I've done. Typically, I also post these up to YouTube as well. The goal, like everything, is to educate and get the word out about home care services to people in the greater Boston area and throughout the country to better inform you so you can make the right decision for your loved ones. If you are looking for home care services, consider Minute Women. If you live in the greater Boston area, Minute Women provides in-home services for seniors. We specialize in dementia care, Alzheimer's and other dementias for folks that are mid-stage and late stage. So if that's something that you're struggling with, or you want to have questions, or if you want to call up the office and just say, hey, listen, I'm not ready for home care services yet, but I'd like some resources, we're happy to do that. One of our core values is education. So we are not afraid to have that conversation with you and hopefully help you in this journey, because it needs a lot of support. And so today I wanted to talk about kind of three ways dementia care services help seniors living with dementia, and talk about kind of what traditional home care is versus what specialized care is, and kind of what those three differentiators with specialized care mean. So for a very long period of time, Minute Women, the company that I own, was started by my aunt in 1969. I think they became fully incorporated in 1973. So you have to look us up on the internet. You'll see 1973, but I'm sure there was some work being done in 1969. Maybe it wasn't completely on the up and up, but 1969, and until about 3 years ago, 2 years ago, 2 years ago, we continued providing traditional home care. Traditional home care is amazing. It helps seniors. But when it comes to dementia, what we were finding is that traditional home care could help to a point. It helped really with early stage dementia, where somebody may repeat themselves a few times, but did not have the difficulties of middle stage, moderate stage, and severe late stage dementia. So when you're looking at kind of early stage Alzheimer's, you're looking at somebody that might be repeating themselves, might be coming up with the right, their common difficulties are coming up with the right word or name, remembering names when introduced to new people, have difficulty performing tasks in a social or work setting, forgetting material that was just read, or losing or misplacing a valuable object, things like that. And those are things that traditional home care has typically done a good job of helping with. You're still focusing on ADLs. And what we found with traditional home care is that, which was what we were doing as well as many other agencies are doing, is that we were really good until we hit the moderate stage of Alzheimer's and dementias. And then our caregivers were not trained, were not prepared, our staff wasn't prepared to handle the challenges that come with the progression of this disease. And that means that family members were frustrated with the care that they were receiving. Caregivers were feeling overwhelmed. They would leave a case or resign from a case because they felt like they weren't getting the support that they needed, and they weren't providing the care that they wanted to care, the level of care that they wanted to provide, and which just kind of eroded those cases. And so we were talking about, well, what do we do about this? Like, we're clearly not meeting the level expectation. And when I would go into my mastermind groups, I would find out that you know, agencies that were in like deep red states like Kentucky, they were required by the state to provide 8 hours of dementia care, dementia training and education annually for their caregivers. And Massachusetts, a very blue state, no regulation whatsoever. So it was kind of strange. It was kind of, it opened up our eyes. It said, hey, listen, we need to do better. We need to provide a better level of service. And if the government isn't going to elevate us, well, then we should be elevating ourselves. And in theory, all agencies and companies, whether you're in any industry, should be always striving to provide better and better service and more value for the cost of services. Additionally, as rates continue to go up, and the pay for caregivers continue to go up and everything gets more expensive, you're going to, families understandably are going to expect a higher level of value for the amount that they're paying. And that can be a challenge for some private home care agencies. So that is where we kind of look at. So when I talk about traditional home care, we call that kind of dementia light care, where you're helping with the early stages of Alzheimer's or dementia, and then when you're getting into the mid and late stages of dementia, that's where we feel it's the specialized care, because these caregivers need to be trained on what they're going to be facing, the challenges that they're going to encounter, and how to go about providing the right type of care for somebody who is living with dementia, and understanding that these are symptoms of a disease and not the person themselves, right? It's the disease that is causing some of these challenges, not necessarily the person. And so where that kind of comes into is that you really need to have dementia care expertise. You need to go all in and invest. And so what we've done is we've partnered with the Alzheimer's Association. We've multiple people in the office are trained in their person-centered care training program, so that they can train caregivers. We have partnered and worked with a company called All's Better, ALZBETTR, that is actually owned by a company down in New Jersey. His name's Gary, that provides specialized care for those living with dementia, and they created a training program. And we use a little bit of a hybrid of the person-centered care with the All's Better training app to train our caregivers. And the All's Better training app is certified with the Alzheimer's Association person-centered care. So somebody that goes through the All's Better training program can then get essential Alls certified through the Alzheimer's without having to take the course. They can just take the test immediately. So we have really focused around the Alzheimer's Association and their training. Now, Alzheimer's is not the only type of dementia, and what we're finding with the Alzheimer's Association is that they are expanding into providing support and training and education around other types of dementias like Lewy body or Parkinson's dementia or vascular dementia. And it's not just all Alzheimer's, but it makes sense what they were doing, because the majority of dementia is Alzheimer's, right? All dementia is the umbrella, kind of like I say that, private home care is the umbrella, and we fall under that umbrella with Minute Women, but we are specialized private home care services. The umbrella is dementia, and Alzheimer's is under that umbrella of dementia, but is the biggest portion of the types of dementias that are out there. And so the next part of the three ways dementia care services help seniors, I guess, is going to the specialized training. So we in the office need to become experts on dementia and Alzheimer's, which is why we've gone through the person-centered training, train the trainer through the Alzheimer's Association. There are other resources out there like NIDE and TIPA Snow that provide great training that maybe down the road will incorporate and investigate and maybe incorporate some of their trainings. But since we have a relationship with the Alzheimer's Association and we had already been going down this road with them, we continued to work with them. And so now that we feel that we are providing, and in the office our dementia care expertise is good, it's always growing. It's always going to continue getting better as new therapies come up, new ways to approach this disease continue to evolve. And it's going to be the old saying of striving for perfection, but knowing that you'll never attain it, but getting as close to it as possible. But then we need to specialize train the caregivers, and that is where I kind of talked about the All's Better app and the services that are or that we have with that. So their caregivers come in, they do 8 hours of training with on dementia, which we have two caregivers in the office right now going through that, and then they have a foundation to really understand what dementia is and to better their their expertise. Now, when we hire caregivers, typically we're looking for two out of these three kind of segments of caregivers. We're looking for professional full-time caregivers, and we're looking for professional part-time caregivers. Typically what we're not looking for is somebody who sporadically is a caregiver. So they got a HHA certificate a number of years ago, but sometimes they work in home care, sometimes they work in retail, sometimes they work in food services, sometimes they're, doing something else, and then they come back when they lose their job or quit a job or whatever happens, and they use home care services and home care jobs as kind of a backup. We really want those folks that are looking at this as a career, and they want longevity, and they want to invest in themselves, and they want a company that's investing in them as well. And so when we're hiring caregivers and putting them through our memory care professional training, that is the type of caregiver that we're looking for, the type of professional that we're looking for. I know that, a lot of times folks say private home care is non-skilled, and skilled is typically like home health, where there's a nurse or a physical therapist or an OT providing care, and that's skilled care. We're getting away from saying that, and we don't really use that vernacular anymore. While it certainly, I understand why it's there, I think there is a skill to providing hands-on care to seniors. That is a skill that not everybody has, and to call it non-skilled is kind of a disingenuous way of labeling a very large segment of the population that is doing the majority of work when it comes to caregiving, right? So, and anybody that has had to go in to care for somebody, especially if you don't know who they are. So, I mean, imagine yourself, and let's say you have no background in providing care. Imagine I just plucked you and put you into a nursing home, or put you into one of my clients' homes, put you into an assisted living, and you were supposed to provide care for these individuals. You're supposed to help them go to the bathroom, transfer on and off of the toilet, help them get in and out of chairs, and help them take a shower properly and safely. You would probably be coming to my office very quickly and saying, I have no idea what I'm doing. And I'm very concerned that I'm going to make a mistake and hurt myself, or even worse, for most people, they're more concerned about hurting this fragile senior. So when you look at it from that perspective, I definitely think our caregivers have skills, and this care population, our care team and home health aides and CNAs are definitely a skilled position. They're just not that higher level of educated, skilled position that you need to be to become a physical therapist, which you need, I believe, have a doctorate degree now. So listen, I know it's not meant to be mean. It's not meant to be like a dig on people. But we don't really use non-skilled, because the amount of training that we're giving caregivers, the amount of support that we're giving caregivers, that is making them much more skilled. And so when a caregiver goes through memory care professional training, they go through those 8 hours, but let's be realistic. If you had to sit through 8 hours of training, how much of that are you going to retain? And so our focus isn't necessarily on them needing to know the the reasons why dementia or Alzheimer's develops, right? That would be great for them to know. But where our focus is on the practical skill sets to provide hands-on care for someone with dementia, what to do in specific situations. And with our training, we also can provide specific trainings, short videos that they have already watched, but then we can resend out in like snippets, almost like YouTube short videos, if you will, or TikToks that are a bit longer. They're between 8 and 15 minutes long that say, hey, listen, this person has these challenges, and this video is going to help you um, get refreshed on what to do in these situations. And that kind of goes to our person centered approach, a personalized approach with providing care to these vulnerable seniors that are living with dementia. And so what what we look at it as is every single person's journey with dementia is going to be unique. It's going to be different. Sure, there will be similarities, and approaching people are, and approaching a situation may have commonalities from one person to another, but kind of like we're all unique. We're all going to have different challenges and different symptoms, and not everybody's going to be the same. We've had situations in with Minute Women where people have been on a live-in for a very long period of time, and then when the live-in ends, they don't know how to do some basic ADLs that were not required on that 2 or 3 year long live-in, right? So somebody was a private caregiver for a family, then the case ended, the person passed away. They got hired at Minute Women, and they're saying, hey, listen, I haven't had to do X, Y, and Z in 3 years, and I know how to do it, but I need a refresher on that. And that's what I mean by sending these refreshers out, where just because you've watched a video 6 months ago on how to approach somebody correctly doesn't mean you've retained all that information. So when we sign somebody on services at Minute Women, we go through their assessment and not only find out what their ADLs are, but find out what their triggers are, what may cause them to have challenges, and then try to put together as much of a comprehensive care plan as we can. To be quite frank with you, I think we're lucky if we get 50 to 70% of the information we need from family members. And that isn't to be mean to family members. There's some family members that are states away, right? They don't see mom. My dad's down in Florida, right? I see him once or twice a year. So if he was going through dementia, if he had dementia and he was living with dementia, I'm not going to know everything, all the challenges that are in the household because I live 1,500 miles away. So that isn't necessarily to speak ill of a family member. It might be like, and there are we've met family members. I remember one client. We went in to provide care for somebody, and the the adult children lived in the same town as their mom, who had like moderate, mid stage dementia, and didn't know about it because dad was so good at hiding it from the kids. So when they would go and visit mom, they would, what do you talk about with somebody that's older, that's not really active in the community anymore? Like I call my dad a couple times a week, and he doesn't have any crazy news. Like he was talking about how they're putting a new roof on the house. Like, it's great, but I mean, that's not like, hey, I went down and I saw the sporting event, and then I went to this cultural fair, and then I went out to dinner at this new exotic place that just opened up, and then we went over and played golf at a new golf course. Where you're like, oh well, tell me more about that. Well, yeah, I'm just hanging out playing on my computer, and they're doing the roof, and it's really loud. Okay. All right, what color's the new roof? There's not a whole lot of substance to get into on that one. And so when you have family members that don't have that kind of new experiences going on, what do you revert to? You end up talking about the past. And when you have dementia, the first one of the first things that becomes difficult is remembering current events and current memories that have occurred, and and you can speak very well and fluently about what's gone on in the past. So they would go in and talk with mom and talk about the past and talk about things, and she seemed perfectly fine. But then when they asked questions to her about current events going on, the dad would chime in and say, "Oh yeah, I took care of that bill. Yeah, it was a problem here. Or, yep, we're getting the steps redone in the back because it was a little unsafe." because mom wasn't going to remember that, and that was his way of protecting her, probably because they were worried he was worried that they were going to send mom to an assisted living or a nursing home, and he wanted his wife with him, right? So that is where family members that live 5 blocks down the street didn't know that mom was having memory issues for a long period of time because family member the spouse was doing a really good job at keeping that a secret. So family members may not know all of the information to give it to us to be able to provide a proper care plan at the start of a case. And so then we know that going in, and then we talk with caregivers, and then we fill out the rest of that care plan and approach it from a very personalized approach so that it's very specific to that individual, and it allows the caregivers to have a care plan that is going to be different for every single client that we have. And that way they know that that care plan that we go over with them and they have access to in their app is updated. It is in near real time. It's updated every few months as the disease progresses as needed, but at least every few months, maybe at the most every 6 months. And they have that tool in their toolbox to say, hey, listen, these are the challenges. Here are the videos to refresh yourself on that. Make sure that you review these, so these are going to help you be successful with this individual. And that's where that personalized approach comes in. And then obviously we have supervisors, maybe not obviously, but we have supervisors that go in and check in with the caregiver, check in with the client. Our director of operations, Adrian, and Debbie, are co-owner, but our marketing person that's out in the community is also checking with family members, because oftentimes family members, that's the first contact. They talk for quite a long period of time at the beginning, and so they feel a bit more comfortable for a period of time after a case starts with Debbie than anybody else, because she's a known quantity and they've been already established a relationship. And so it is about communication and working together and collaboration to be successful in the home, and that all comes down to a personalized approach to provide care for individuals. So those are 3 ways that we've looked at specialized dementia care to be unique from what traditional care does. Traditional care is great if mom or dad has a fall, or they have mobility issues, or they're starting to have memory problems. Traditional care can help out with that. Dementia care light can help out with that. But when somebody is going through, the symptoms of mid and late stage Alzheimer's and dementia, is really when you need a care team around you that is trained, that understands the complexities of the case, the challenges of the case, what works, what doesn't work, and has enough tools in the toolbox, because what works on one day may not work on the next day, and then what worked that day, um, what worked on Monday may not work on Tuesday, but what worked on Monday may work on Wednesday. And so you need to have different approaches on how to handle different situations. And you'll find that as the memory care professional becomes more ingrained with that senior, understands the situation, understands what the challenges are, and has been trained on the approaches to handle those challenges, they are going to develop a relationship, and they're going to be able to understand what works best and what isn't working in that specific for that specific client. And then we take that information, update the care plan, and we relay that information to any and all of the caregivers and memory care professionals that may be in the home. As the case progresses and they need more care, you're going to need more memory care professionals, which means we need to make sure that that information and that personalized, person-centered approach is communicated to everybody that's going to be providing care for that person. So everybody on the care team is on the same page. So that gives you an idea of what we look at when we're providing care for somebody who has dementia. That way that they understand, you understand what that approach is. So whether you're local to Lexington, Massachusetts, or the greater Boston area, we'd love to talk to you about that. But even if you're outside of the greater Boston area, you're outside of Massachusetts or New England, you can understand where that where that kind of mindset and that approach comes from. And if you have a loved one that's living with dementia, you can find the right agency that is hopefully doing some of the things that we're doing. And we're not perfect either. I'm sure there are agencies out there that are doing things that we would want to incorporate as well, which is why we're part of those mastermind groups, and we're in communication with other agencies that provide memory care in the home. So, anyways, I hope you have a great Thursday. I know it's not great outside right now. Looking from the background, I can hear the rain coming down and the sleet and the snow. But stay safe out there. Enjoy your coffee, and we'll catch you on the next one.